Nursing observation and documentation should focus on the assessment of the patient in relation to the 13 canons identified by Nightingale when nursing care is provided, that is framed by her environmental theory. Out of the 13 canons, we can talk about 4 of the canons that are observed in this clinical scenario. These 4 canons are ventilation and warming, noise, petty management, and bed and bedding. Ventilation and warming. When the patient was brought to the PACU, the nurse noticed the patient was cold and shivering, so she immediately gave her a blanket. Another factor that contributes to the patient's health is proper ventilation. A PACU is a closed room with no windows, which means sunlight cannot directly enter the room. In the clinical scenario, we can see that the patient may have been irritable because of the plain room, and lighting is dull because there's no direct sunlight. And when the nurse sprayed the freshener, it caused her to have an asthma attack because the odor was not removed from the room immediately. Nightingale talks about the importance of warm environment and proper ventilation in her 13 canons to promote healing in a patient. Noise. Patient complained about the noise in her surrounding. Noise seemed to worsen her condition along with the pain she was already suffering. Nightingale says noise can contribute negatively on a patient's healing, so it is very important that a patient is in a quiet environment and resting peacefully. Another one was bed and bedding. Patient passed stool and the nurse failed to immediately clean the patient, which caused the patient to become more irritable and unstable. Nightingale mentions that a nurse should be aware and perform immediate care to the patient so chances of negligence can be avoided. And lastly, petty management. The trash bin was near the patient's bed and had soiled products. According to Nightingale, soiled products can pollute the air, and improper sanitation and environment has a negative impact on health. Since the nurse did not perform proper care immediately, this led the patient to remain unstable.